In the medical profession, a general practitioner is a medical doctor who treats acute and chronic illnesses and provides preventive care and health education to patients. A general practitioner manages types of illness that present in an undifferentiated way at an early stage of development, which may require urgent intervention. The holistic approach of general practice aims to take into consideration the biological, psychological, and social factors relevant to the care of each patient's illness. Their duties are not confined to specific organs of the body, and they have particular skills in treating people with multiple health issues. They are trained to treat patients of any age and sex to levels of complexity that vary between countries. The role of a GP can vary greatly between countries. In urban areas of developed countries, their roles tend to be narrower and focused on the care of chronic health problems, the treatment of acute non-life-threatening diseases, the early detection and referral to specialized care of patients with serious diseases, and preventive care including health education and immunization. Meanwhile, in rural areas of developed countries or in developing countries, a GP may be routinely involved in pre-hospital emergency care, the delivery of babies, community hospital care and performing low-complexity surgical procedures. In some healthcare systems, GPs work in primary care centers where they play a central role in the healthcare team, while in other models of care GPs can work as single-handed practitioners. The term general practitioner or GP is common in the United Kingdom, Republic of Ireland, Australia, Canada, Singapore, New Zealand and many other Commonwealth countries. In these countries, the word physician is largely reserved for certain other types of medical specialists, notably in internal medicine, while in these countries, the term GP has a clearly defined meaning. In North America, the term has become somewhat ambiguous and is sometimes synonymous with the terms family doctor or primary care physician, as described below. Historically, the role of a GP was once performed by any doctor with qualifications from a medical school and who works in the community. However, since the 1950s, general practice has become a specialty in its own right, with specific training requirements tailored to each country. The 1978 Alma Ata Declaration set the intellectual foundation of primary care and general practice. The basic medical degree in India and Bangladesh is MBBS. Bachelor of Medicine, Bachelor of Surgery. These generally consist of a 4.5-year course followed by a year of compulsory rotatory internship in India. In Bangladesh it is a 5-year course followed by a year of compulsory rotatory internship. The internship requires the candidate to work in all departments for a stipulated period of time, to undergo hands-on training in treating patients. The registration of doctors is usually managed by state medical councils. A permanent registration as a registered medical practitioner is granted only after satisfactory completion of the compulsory internship. The Federation of Family Physicians Associations of India is an organization which has a connection with more than 8,000 general practitioners through having affiliated membership. In Pakistan, 5 years of MBBS is followed by 1 year of internship in different specialties. Pakistan Medical and Dental Council then confers permanent registration, after which the candidate may choose to practice as a GP or opt for specialty training. The first family medicine training program was approved by the College of Physicians and Surgeons of Pakistan in 1992 and initiated in 1993 by the Family Medicine Division of the Department of Community Health Sciences, Aga Khan University, Pakistan. Family Medicine Residency Training Program of Ziauddin University is approved for fellowship in family medicine. In France, the Médecin Généraliste is responsible for the long-term care in a population. This implies prevention, education, care of the diseases and traumas that do not require a specialist, and orientation towards a specialist when necessary. They also follow the severe diseases day to day. They have a role in the survey of epidemics, a legal role, and have to contribute to a night and weekend duty. The studies consist of 6 years in the university, and 3 years as a junior practitioner. This ends with a doctorate. A research work which usually consists of a statistical study of cases to propose a care strategy for a specific affliction. General practice was established as a medical specialty in Greece in 1986. To qualify as a general practitioner, doctors in Greece are required to complete 4 years of vocational training after medical school, including 3 years and 2 months in a hospital setting. General practitioners in Greece may either work as private specialists or for the national healthcare